So I went with my grandmother to her last doctor's appointment, and they gave her this pamphlet. It says, "Stay independent. Falls are the main reason why older people lose their independence." So my grandma got this, and she put it away in her purse. And as soon as we got into the car, she handed it to me. And I'm wondering, Grandma, why you handed me this pamphlet? And it's not that my grandmother couldn't read, but she didn't understand everything that the doctor was saying during her visit. So she just assumed that she wouldn't be able to understand this pamphlet. So her immediate reaction was to give it to me to try to explain it to her. And so as I read it and I started to explain it to her, the thought came to my head, who decided that this was the best way for my grandmother to learn, how not to fall? They don't know that my grandma loves to watch The Price is Right. They don't know that my grandma really likes crossword puzzles, and maybe a cool image like a newspaper cartoon would have been a lot more effective than handing her this pamphlet, which she was able to hand to me.
I'm an immigrant to the United States. I don't have the same resources as people who've been here for a long time. And like many other Americans, I was uninsured when I first came here. So when I had a problem, the first place I would turn to was the internet. And there was all this information telling me about things that I'm pretty sure I don't have. It's hard adapting to a new country. It's hard figuring out the ways of the land. It's hard knowing who to trust and also what to trust.
So currently our Pandora, our Spotify, all of our apps, they adapt to what we like by the click of a button. But the one thing about medical jargon is that it doesn't necessarily change. It remains static. And we continuously go online and Google what we need, and it may not always fit the education level, the language barrier that the patient may need. So this is where we come in.
And our goal really is to bridge that gap, basically by taking information that generally patients find and bring to their doctor to begin with, and having that go through a process where it's vetted by physicians and at the same time run through our machine learning algorithm so that we can pull out the most effective pieces of knowledge and information out there for the patient according to their preferences.
Instead of just handing a patient a piece of paper, we're handing them a tool that through our platform will adapt. If a patient sees something that they don't like, they click, I don't like this. If they feel that something is a little bit too advanced for them, click that. This is too advanced for me. They get a chance to put that into the app up front.
Through this app, I'm able to get information in a way that's understandable to me in my own language.
We hope that in the future, jargon can be used in the following facets. First, in a medical practice or clinic setting in which a patient can enter preferences in the waiting room so that their doctor can provide info at their level of understanding.
Soon, a doctor can choose already curated clipboards or have the option of creating their own personalized clipboards for common disease processes that they treat in their practice.
By aggregating the best resources and collecting data on how patients respond to their tailored experience, we hope to learn what works best for patients so we can eventually become content generators, enhancing patient education and ultimately improving patient compliance and outcomes.
And that's our objective, to provide personalized patient information that is entirely dependent on the patient that it serves and adapts to fit that patient's needs and that patient's level.